Hey everybody, thank you so much for having me. Really thankful to our course directors for pulling off another electronic year of the nutrition course. It's so neat to be logged in. What's nice about it being electronic is actually I've had some family members watching over my shoulder. There's so much interesting stuff to learn about this year, even if you're not a medical provider. So I hope you're all enjoying it as much as I have been. I'm going to start by just giving you these disclosures. As much as I can, I've avoided off-label usage of devices and procedures, so that won't be a big part of today's talk, but I will try and call out not yet FDA-approved therapies with this red non-FDA approved marking as I've indicated here. So the objectives of our talk today, I'm going to help you appreciate the expanding role that really all of us, all wellness providers, play in the managing of our current obesity epidemic. We'll talk about and understand how gastroenterologists are helping to fill a gap in procedural treatment of obesity. And we'll define the terms specifically endobariatrics and metabolic endoscopy, which are emerging fields within gastroenterology. We'll review several endobariatric procedures that are commonly performed here at the Mayo Clinic as well. So we all know that disability and death are associated with a high body mass index. This is fairly old data from the New England Journal of Medicine. This doesn't come as a big surprise to most of the attendees of this lecture. The epidemic is significant and growing, as we learned earlier today. A 4% increase since 2015 in clinical obesity in the United States, a disproportionate effect on minorities. It's associated with a lot of comorbidities that will shorten or can end a life. And so what's the big deal? Particularly pediatric obesity is something we're starting to pay attention to. This is a picture of my grandfather, who was a primary care. He was a family medicine doctor in rural Pennsylvania administering the oral polio vaccine. And his generation of physicians actually saw a good increase in life expectancy over their time as physicians. But pediatric obesity and obesity in general potentially serves to undo a lot of the work that they've done. So we've seen a triple in pediatric obesity over the past 4 decades. I'm not a pediatrician, but I think it's something we need to pay attention to. Diseases that he never would have thought he'd see in children are now prevalent, and something that my sister as a pediatrician is seeing in clinic every day. Obesity, non-alcoholic fatty liver disease, cirrhosis, liver transplant in children because of fatty liver disease, and type 2 diabetes. These are things we never thought would be possible in children. So the problem and our legacy potentially is that we're going to see a decline in life expectancy based on computer modeling here in the United States over the 21st century.